This happened to me, a client who's like receptive to putting a feeding tube in their cat, and then like they'll go home and say to friends or family, whatever, here's what I'm thinking. And they get a very negative pushback, right? Because it's got just this negative connotation. Right. And friends and family can make them feel like they're being cruel.
That's right.
Welcome to the Purr Podcast, your favorite feline-focused podcast, where we dive into all things feline. Medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Jolle Kirpensteijn, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started.
Hi, I'm Dr. Susan Little, and this is the Purr Podcast.
See, that was perfect.
I know, I looked at the camera too.
Oh, look at that.
Yes.
My name is Dr. Jolle Kirpensteijn. Very excited
You didn't look at the camera.
No, because I'm looking at you.
Yes. So nice.
Full adoration. But this is the Purr Podcast, and we are here with Dr. Katie again.
Yes, thank you for having me. Part two.
And this part two is going to be all about feeding tubes.
Yeah.
Okay, great. That's my jam.
Katie and I are fine.
All right.
You can go get
See you later.
You know,
just come back from the exit.
I think you asked me once if I wanted to do a feeding tube lab with you
I did.
at WVC.
Oh,
I
Never
did.
happened though. Yeah,
we'll do it with you. Ashley Sullivan.
I used to do them with Craig. Oh, he's going to hate me now because I'm forgetting his name.
Oh my gosh.
Colorado.
Craig, Colorado.
Oh, what?
Thank you.
Yeah. Craig's the best.
Total blank on
Grandma's
that.
getting old.
Yeah, it's okay.
Poor
He
Craig.
probably would have done it to you, so it's fine.
Okay, yeah, good, we're good.
You're good.
Yeah,
Anyway.
for several years we taught
That
at
is fantastic.
Yeah, what happened?
they rotate through labs, so
Yeah.
They were tired of you.
Yeah, we did it like 5 or 6 years in a row.
Like placement, how to feed.
Yeah.
Yeah, that's great.
Yeah, we did like a half day and a whole bunch of feline procedures, but knowing me and Craig, feeding tubes were like front and center.
That's awesome.
Nasogastric, but esophageal.
How did you do it? Did you have cadavers? Did you have like teddy bears?
Cadavers.
Like, yeah. Okay. Okay. So you had like actual
Cadavers.
Got it.
Yeah.
Okay.
Right, which is better than other options.
Yes.
Right. Obviously still some differences, right, with a live patient. But the nice thing about cadavers is you don't have to be afraid.
Right. Yeah.
Right. So
I haven't used, and I've heard that the simulated cadavers, the syndavers, I've heard are fantastic, but I haven't.
We've seen them. Remember, you and I saw some. Did we see veterinary or human version somewhere, Yola? Somewhere you and I where we saw.
Yes, that's something.
Yeah, the consumer electronics. I wonder if that was human, but we've seen them.
Yeah, they're
So
how expensive are they?
No, they're pretty expensive. I think they're getting cheaper because more and more companies are coming up with them. I have not used though. I've used syndavers for like blood draws and those sort of things, but I haven't used them yet for the assisted feeding.
And you might want to explain to our audience
what's a syndavер?
It's like a simulated animal, so a simulated cadaver, and so essentially it's made out of, I don't know, some sort of material, silicone, something
rubber,
like this,
whatever.
but it's designed to take the wear and tear and mimic what it would be like to actually place a feeding tube or, do a blood draw in a real life patient.
I'd be afraid of damaging the syndavер.
I know. You do have to be careful with the ones for the blood draws. I mean, they're pretty. The ones I saw for the blood draws that we did were pretty forgiving, but but they also are smart in that. At least the ones that I was using, the vein was essentially like an extension set and a fluid line. So, and those could be replaced.
Right.
So you could keep putting holes in those, and then you just replace them.
Yeah. Okay. Yeah, that's good.
Very cool. Very cool.
Very
So
cool.
feeding tubes, cats.
Yeah.
Hot topic.
Hot topic.
Why don't people use them more?
I know.
What do you think the barriers are?
Well, I think that one of the biggest barriers is probably that people have a lot of experience with feeding tubes in humans, like when they're taking care of maybe like an elderly parent or something like this. So it tends to be the thought is it's sort of like end of life kind of measure. Whereas we know for cats, it can extend their life, it can provide quality of life. It can take away the stress of medicating a cat. It can be an option where you can give fluids, so you don't have to give subcutaneous fluids. You can give oral fluids. So it can really be beneficial to the management of many different diseases. But yeah, there's a big barrier. I think also there is not a lot of time to teach how to place feeding tubes. And so that's an issue, although it's quite easy to do.
Yeah, it's easy, but it can look a bit daunting.
Yeah,
right.
Absolutely.
Yeah.
And if you have one bad experience, then I think
Everybody
that can
has
be
a bad
difficult.
With
Yeah.
something,
So,
yeah.
You probably are earlier in starting to discuss feeding tubes than anybody else in this world. How? So when do you start talking about it, and how do you start talking about it to your clients?
Good question. I mean, we have a service. Ashley Self is my veterinary nurse and nutritionist, who's fantastic. Both of us we see cases where they come in to see us for chronic diseases, but then we also see hospitalized cases through multiple different institutions. So sometimes they come in already having a feeding tube. When they come in, they don't have a feeding tube. I think one of the problems that we have to correct, especially with general practitioners and veterinary nurses, is this discussion that in a patient that is not eating very well, that you just have to find the right diet for them. And I feel like
Heavy sigh.
yes, heavy sigh. There are very few cases where I actually think that that's true. So typically when I get the case, it's referred to me when they have a very, very poor appetite. And I think I'm going to find the magic bullet, if you will, to fix the appetite, which is not generally the case, unless there's some way that we can help to, fix the disease. And so we're really feeding tube forward from the perspective of the more that we talk about, the more that we earn their trust, then if we can keep having those conversations, generally in the first time we have the conversation, they're not going to choose to do a feeding tube. But the more that we can establish a relationship with them and explain to them why, that can be really helpful. Ashley is doing this really cool thing where she's trying to create a group of families who have pets with feeding tubes and have a place for them to have discussion. And she can lead the discussion too and talk about some different things, some ways that you can optimize feeding tube management, for example, making your life a bit easier in terms of the syringes that you choose, et cetera. So I think that will be really cool if she can get that off the ground, because I think that will help people who are maybe a bit scared of feeding tubes to come to that discussion and see, what were the things that were kind of an uphill battle at first, but then how did things go once you felt comfortable to use the feeding tube?
I think that support will be really good.
Amazing.
And another way I think it'll be good is that maybe you have a client, this has happened to me, a client who's like receptive to putting a feeding tube in their cat, and then like they'll go home and say to friends or family, whatever, here's what I'm thinking. And they get a very negative pushback, right? Because it's got just this negative connotation. Right. And friends and family can make them feel like they're being cruel.
That's right.
And so having a support group, right? So the other way that I've tried to counteract that a bit is like one of my cats had a feeding tube for like 9 months, and I took a lot of pictures and videos.
That's fantastic. Yeah.
And my son, Ben, who is our audio editor, when he was when he was quite a bit younger. And so I took some videos of him tube feeding the cat.
That's awesome.
And so I can show, we use those to show to owners, right? Like if my little son can tube feed, right? And here's my cat out in our back garden with his, nice little collar.
That's right.
On.
It doesn't have to restrict their activity.
He's walking around. He likes the garden. So I think that helps too, to show people what it really looks like.
Yeah.
Because
and also making sure that they have support in the very beginning, because in the very beginning it is very difficult, especially for maybe a cat that doesn't actually want to be held while you have to come up with some strategies to figure out, how can I feed this cat that doesn't want to be held, and
maybe they never like to be held.
During the 15 to 20 minutes that you need to give the feeding. So it can be quite difficult. So I think the most important thing is that what I see happen sometimes with internists in particular is they sort of present it as this option that's going to fix everything. And don't talk about the challenges that there's going to be, especially in the beginning. And I think we do have to be transparent and honest about the fact that for the first week or two, food's going to end up on the ceiling and the cat's going to go running, or there might be some crust around the feeding tube that scares you. Yeah. So all of that has to be an honest conversation so that they know, hey, they told me that in the first week or two, it's going to be an uphill battle, but it's going to get better and we're here to support them. one of the things that we find really, really impactful and important is that we try to proactively schedule a feeding tube recheck within 3 days of placement of the feeding tube, which not many people surprisingly do. They sort of recheck them for the disease state, but they don't recheck them to say, how's the feeding tube going?
Yeah, what are your challenges?
And so that appointment is strictly about, and Ashley does them, so let me not take credit for them, but that appointment is strictly about how's the feeding going?
Yeah.
Like,
that is such a good idea because, you know, I'm not pulling the reference to humans. Like if you have a stoma, you get not only your disease treated, you also get this care for your stomach.
Exactly.
You know, and you have to come in and check everything out. And
you don't even often have to go in. I had a family member who had a stoma for a long time, and for at least part of it in the early stages. Like a licensed practical nurse, like their nurses who specialize, right? And they'll come to your house and help you with everything from supplies to just.
Which we could do in veterinary medicine if we better support our veterinary nurses through education and through pay. But that's a topic for another day, probably. That's another podcast,
but
maybe.
You know what? You mentioned that. You mentioned that your nurse does that, and she has her specialty in nutrition.
She does, yeah. She has a master's. She has her specialty in nutrition.
That's great.
So she's a licensed veterinary technician and has her BTS in nutrition.
It's nice to see more of that happening. But you know what? Even an experienced technician in general practice could do
100%.
Right.
Yes. If they're provided with the opportunity to learn. And yes, absolutely.
So I think you need to start a YouTube channel.
Yeah.
There you go.
About feeding tubes or about veterinary nurses?
No, feeding tubes.
Okay. Yes.
With your nurse. I mean, I think that would be great because I think people are looking for information.
That's a great idea.
And so short video clips of how to do it, and I think YouTube is a perfect.
That's a great idea. Okay.
So that's the tip.
Okay, I like that.
Right.
I like that tip.
So, people are very inventive. To overcome.
I think it is so right that we propose feeding tubes as being the fix-it-all, but we don't give the support.
Right.
And so, and people are always worried about how long can I keep them in, and and especially in cats. I mean, we probably keep them in for a long time.
Oh yeah. Oh gosh. Yes.
And so.
And I guarantee it'll come out at least once.
Right,
yes.
Right.
But you're right. Like, and I think part of the problem is probably that we as educators don't do a good job in teaching them.
Right.
How to address the complications that occur or will occur with feeding tubes, and what are the solutions?
Now, I want to cut some slack to some vets because a lot of vets just don't know.
Well, that's what I'm saying, because we haven't educated them to know, like, what do you do when the diet plan you came up with won't go through the tube? Like, how do you think about a different diet? We don't take them through. Most of the time, many vets only know how to use a canned diet with water. Yeah. Sometimes that volume is too much for a cat. So they don't know necessarily how to use a dry diet, with a water or with a liquid diet even.
Yeah, that's my favorite.
Yes. So, I mean, I think that is, again, kind of back on us as educators. And maybe the YouTube channel is the solution where we can help to better educate.
Or we need to do more feeding tube wet labs, and we'll bring like blenders and food. No, seriously.
No, I know.
I mean, it is so true because, I don't want to brag about our diets, but the algae diets that we have, you don't have to put water in them. Yeah. And they're still doing really well through feeding tubes. So there's diets that
can go straight through the tube.
Right.
Yeah.
And you don't have to.
Important.
But I do think that owners struggle with it, and that's why I was suggesting the YouTube channel, because it's the same things that they struggle with. Mm-hmm. It's not that it is really difficult to find a Q&A for feeding tubes.
You're right. Yeah.
And
lots of tough.
Right. And I can remember that also from my own experiences, that in the beginning that you're really worried about feeding tube, and the more you do, the easier it gets, and the more you put it. So the first one is always the most difficult one, and then
absolutely,
after a while you get so used to it that you're even thinking about, even before, and that was for me, it was in surgery obviously, even before, let's put it in feeding tube.
Oh yeah.
And if we're not using it, if the cat eats fine afterwards, then we'll pull it.
Yeah.
That's the worst thing that you can do.
I think surgeons could be a big help, right?
Being proactive.
Yeah. I mean, there's lots of times, I don't know, a cat that let's say needs some biopsies done, and we can place a feeding tube at the same time. And,
Yes.
you know, especially if it's
Especially if it's not eating.
yeah, especially if it's not eating. The oncology people do a good job, because my cat who had the feeding tube for a long time had it because he had an oral squamous cell carcinoma, and the oncologist who was doing his radiation treatment said they all need feeding tubes.
Yeah.
Put it in well in advance,
Right.
a good plan of nutrition,
Yeah.
and then he goes in and gets his radiation. I
Yeah.
thought, I love
Smart.
you.
Yeah.
Yeah.
Right. Yeah.
Right?
Yeah.
That's exactly it. So let's talk a little bit about the different kinds of feeding tubes.
Sure.
I think we go through times of popularity in these things.
Mm-hmm.
When I started, which was a long time ago, it was always gastric feeding tubes.
Mm-hmm.
Then
Okay,
suddenly
tubes,
we
yeah.
went to the nasal feeding tube,
Yeah.
pharyngeal fusion, and now we're doing esophageal nasal. So
Yeah.
what is your favorite and why?
I don't have a favorite, if I'm being honest. It depends on the
Come
patient and the
on.
condition. I mean, certainly if they have an E tube, an esophagostomy tube, that provides me more flexibility in what I can feed the animal as compared to, you know, a J tube, let's just go.
Yeah.
Or a nasoenteric tube, because then I have to feed a liquid diet and I don't have as many options. So I would say, like, okay, if you're going to pin me down to a favorite,
Right.
it would probably be the E tube because of the flexibility.
Yeah, I think that's a pretty common
Right.
answer. And it certainly is, as far as general practice goes, it's the one that not only is it most flexible, but GPs can learn. I don't know how to place a J tube. I don't want to, it's not
Yeah.
mine.
Yeah.
But I can, you know.
You can always call me, it's fine.
Okay.
It's
Oh,
not that difficult.
yeah.
Right.
Yeah. But it's a good general practice tool.
Yeah.
Yeah. I do think we see vets who rely on nasogastric tubes for longer than they should. Let's put it that way. And we touched on this a bit in the first part of this, when you were saying something about a cat that's not eating well, and everybody's just focusing on trying to find the food the cat will eat. Yeah, and I think we need to get ourselves away from that, because by the time the cat is feeling sick enough that it doesn't want to eat,
Right.
it doesn't matter
Yeah, no.
what you do.
Yeah, that's right.
Right? And why don't we just cut to the chase and get this guy feeling better
Right.
quicker and get a feeding tube in?
Absolutely.
So I see too much of this, like, kind of, you know, prolonging. Oh, we just need to give it a little bit more time on its appetite stimulant.
Right.
So I like the WSAVA, their nutrition committee has some really nice feeding tube materials, and they, I don't know if you looked at them lately, but they've got this stoplight system, like
That's
sort
great.
of, you know, red, green, amber, right? In terms of an appetent cat, like,
Wow. I'll
right,
have to
the
check
green
that out.
is like, you know, if this is the condition, like maybe you can wait a day or two, and then the orange is like you got a day, and the red is like,
great.
so yeah, have a look at their nutrition
I
committee
will.
stuff. Yeah, I like it. I like the way they've made it easy for practitioners to, like, I always remember now the traffic light because of them.
Yeah.
Yeah.
It's too bad that we don't have a central place where veterinarians and veterinary nurses can go to know, okay, like, here are all the things. You know what I
thought that
mean?
was the Pet Nutrition Alliance. What happened with them?
Well, I'm not sure what happened with them, but I don't think they have all the resources.
They don't have enough resources, and you also, in a way, it's almost too big a group, right? Like you need to have something that's very focused, I think.
YouTube channel.
YouTube, but if I had to pick a place right now, I'd say it's WSAVA's nutrition.
No, I mean,
Yeah.
they do a fantastic
Yeah.
job.
If I picked a
100%.
If I picked
Well,
any
yeah,
place to go,
yeah, the
to
short
them.
dietary history forms, and they
All
have
of
a ton
that.
great stuff.
All of
Extended
that.
assessment.
It's all on
Yeah,
brand, which
everybody
is-
thinks of
Yeah.
that, but they've got good feeding tube stuff. They've got, they've
Yeah,
got
that's great. I'll have
videos.
to check that out.
Yeah.
I didn't even know they had critical care stuff, so that's
Yeah.
awesome.
Yeah, they do. Yeah.
Okay. You heard it here first.
That's it.
Well,
That's
I think
it. Oh,
they've
we
had it
talk
for a
about all
long
the time.
Okay.
So-
You already
So
heard
I
it
don't
here.
wanna-
I heard it here first.
I don't want to offend them thinking she just figured it out. Not you, me. But
I did. I just figured
It
it out.
was
No.
under my watch when the nutrition committee started, so I have
Was it
strong
Yola?
affinity with them. Yeah.
Mm.
was it?
Yeah.
Oh, cool.
So when I was
They are a
pregnant-
great group.
Yeah, they are.
They are a really great group.
Yes.
And they've done so much. They've produced, like, once you get a bunch of nutritionists together with a common goal, boy,
Yes.
they've done a great group.
Yeah.
Yeah,
I have to plug the oncology group too. Those are really good too.
there you go.
So E2 is your favorite. Which one is your least favorite?
Probably J tubes,
Yeah, me too.
just because generally speaking, most of those guys are pretty sick, and the reason that they've had it placed is because there wasn't any great options before that, and it can be quite difficult to provide a complete and balanced diet.
I have a worse one.
Okay, tell me.
TPN.
Oh, I love PN.
Oh,
I love PN.
hated it.
I love it.
Really?
Yeah.
Oh.
I didn't know that was on the table, because if that's on the table, like, I'll pick that one.
Really, above anything else?
I mean, I really like it. I think it's very
Explain
fun.
what it is.
Well, parenteral nutrition is nutrition that you're providing through the vein. And generally, we're focusing more on the macronutrients, so the protein, fat, carbs, and usually B vitamins. Generally, for the short term, we're not providing a complete and balanced diet by way of the vein. But it's a way that we can get animals through a short period of time where they're very, very sick. And for whatever reason, enteral nutrition is not possible, or they can't get the amount of calories that they need through enteral nutrition alone.
So you do have to have a very well-functioning ICU team to be
And a great pharmacy.
I know. That's the whole
Yeah.
thing. Because
Great
So
pharmacy.
it was such
Yes, especially for cats, because there's not really any great options for cats with like 3-in-1 formulas that are on the market that you can purchase. So you really need to have, for cats, for PN, you have to have a compounding pharmacy.
Yeah, they just have like narrower requirements. I imagine dogs the canines are a bit easier. Maybe because
They're a little bit
they're
easier.
omnivores, period.
Well,
so
and
people
you can provide, most of the time, with some exception, you generally can provide those 3-in-1 products that are intended for humans. And so in terms of the requirements and what they can tolerate, they're a little bit closer. Whereas cats, we know, obviously,
Not even
I don't
close.
want to provide something that's so heavy in dextrose to a kitty cat, especially one that hasn't been eating very well. So
Yeah.
that could be
Guess
worst
what'll
case
happen?
scenario.
Bad
Bad things will happen. So yeah.
Okay, so that was my least favorite. But
Okay.
that was mainly because of the care.
Well, I have a great pharmacy at Texas A&M and a great ICU.
Yes.
So thankfully, like, we can do it, and it's fun.
So they don't call you every like half an hour. Oh, the line. is
No,
long.
no,
This is
and
the
also
problem.
pharmacy will come in on a Saturday, on a
Really?
Sunday to make the bags, and they're excited about it. Like, I'm like not lying to you. It's crazy. I can't believe they're like stoked to come in because they love to help the patients.
How much do you think they're used in like other tertiary care settings?
Parenteral nutrition?
Yeah.
Very rarely. I think most of the time, like a lot of
Right.
places that don't have either a criticalist who has good experience in nutrition or a nutritionist, typically where you'll see some use is like people will feel comfortable to use a little bit of amino acid supplementation, or they might use lipids, but it's usually in the context of like detoxifying for something.
True.
But so I think it's pretty rare.
Yeah, so it's the nutrition expertise that's the block.
You have to
Yes.
have that.
Yes.
You
Yeah.
have to have that.
See, we
That's
need
a-
more nutritionists.
We need more nutritionists, and we also, as nutritionists, need to do a better job of bringing the other specialties in and say, this is how you can do this.
That's a good point.
Right.
Yeah, because there's not enough nutritionists right now to go around, and until we have that, we have to do a better job of training the rest.
Well, even if you had enough, I still think it needs to be integrated, right? Like so many things in veterinary medicine, we have to avoid siloing, right?
Yeah,
And
absolutely.
Nutrition has a bearing on almost
Everything. I can't think of anything.
Yeah, right.
Doesn't.
So
Yeah,
it's
The essence of life. So
it's true.
Yeah,
you have one more question.
I do.
Mhm.
What
Then
is
we're
it?
done. It's because we're at time. So that's what I'm trying to say. And you're always like, oh, I want to ask one more question. So this is the question that you have.
Not to put you on the spot.
Right.
Yeah, I had thought of a really good one yesterday, and now
Let's
of
go.
course I forgot it.
Okay.
So here's my second best one.
Okay.
What's the last book you read?
Ooh, what's the last book I read? I read Four Winds by, I think her name's Kristen Hanna, and it was about the Dust Bowl, and it was an amazing
Like the
book.
30s.
Yeah, like
Dust Bowl.
yes, exactly.
Dirty 30s.
Yeah, and like Oklahoma,
Yeah.
the Okies, and
Yeah, John
Texas, and the
Steinbeck all
movement to
Yeah.
California, and it was absolutely a stunning read.
Okay, I have another question then. That was a short answer. So
Okay.
thank you for that.
Sure, I'm glad I had one.
What was the last article that you wrote or was a part of, and what was its conclusion?
What was the last article I wrote, and what was a part? Are you going to be mad if it's not The kitty cat?
No,
No, go for it.
But you
Okay.
can't say the D word. though.
Okay, so we recently published a paper looking at this concept of what's called subclinical gastroenteropathy, which the idea is that dogs and cats, canines and cats, probably have disease for some time before they actually have apparent clinical signs. This is something that exists in humans, but probably is even more of a problem in our veterinary patients because sometimes, pet parents can't see it. And that's right, the animal can't say it. And so we had a paper where we investigated this in a particular canine, the Soft Coated Wheaten Terrier, and found that it is something that exists. And I would be so excited to do that in cats as well.
Ooh,
I
that's
would-
a cool
I would
answer.
think it's quite common.
I
What do
definitely
you think?
think it's common. And in any disease state that you can think of, pancreatitis, for example.
How did you determine in those canines? How did you determine
Good
that?
question. So we did a bunch of different methods. We had video capsule endoscopy, which unfortunately is not available for the cat, which is really disappointing. So we orally administered these capsules to look at the lumen of the guts of these dogs, and we compared them to dogs with protein-losing enteropathy, canines, and then healthy canines. And then we did things like we measured fecal fatty acids. We looked at their fecal calprotectin as a measure of inflammation. We looked at their GI panels. We did intestinal permeability assays. And so with all of those different things, what we saw is that this breed, this at-risk breed, sort of sits in the middle of the dogs that are truly diseased and clinical and the healthy ones. And so cats probably have the same thing where there's a spectrum of disease, right? Yeah, yeah, for sure. I mean, where they come in with full-blown inflammatory bowel disease or GI lymphoma, but there's probably maybe years before that where if we think about the time with which we have to intervene and reverse the disease, especially with diet, like that's the time.
That's the golden period.
That's the golden period. So hopefully we can do that for the cat. That would be...
I like that.
I like that answer, and that
Yes.
brings us to the end.
Well,
Great.
it's nice to end on a positive note where we might actually be able to be more proactive
Yeah.
in the
Love
future.
it.
Yes.
Thank you.
Yeah, thanks for having me, guys.
Yeah,
It was
thank
awesome.
you.
It was really fun.
This is the Purr Podcast, where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.